As a young officer in command of a company of soldiers, we found ourselves sleeping in tents in harsh conditions. Soon after, I awoke with swollen eyes and itching all over my body. I had been bitten by a black fly. I'll never forget my fear when the doctor told me I had river blindness and I may lose my sight. After this, I was convinced I must do whatever I could to alleviate the diseases of neglected people. This passion sculpted the first 10 years of the foundation.
General T.Y. Danjuma has been at the forefront of the fight against neglected tropical diseases, NTDs, in Nigeria, especially in Taraba State, where he comes from, by supporting a formidable local organization, Mission to Save the Helpless, since 1995. General Danjuma's determination to combat diseases of the poor culminated in the creation of the T.Y. Danjuma Foundation in 2009, with the mission of increasing access to quality healthcare, education and empowerment opportunities for Nigerians. T.Y. Danjuma Foundation is the first private philanthropic grant-making organization in Nigeria. Since 2009, the T.Y. Danjuma Foundation has awarded more than 4.7 billion naira for the implementation of over 336 projects in 34 states and the Federal Capital Territory that has directly impacted over 10 million lives. The Foundation's grants in the first decade responded to the most pressing needs of vulnerable people by funding critical projects, controlling the spread of neglected tropical diseases, promoting eye health, providing free medical and surgical services, promoting maternal and child health, creating access to clean water, sanitation and hygiene, enhancing access to quality education, supporting skills training for people living with disabilities, promoting income generation for people at the grassroots, implementing school feeding and nutrition programs, and lending humanitarian support to internally displaced persons. In sync with the Foundation's responsive grant-making approach, each project supported by the Foundation in its first decade was carefully crafted and shaped by input from communities to reflect their most pressing needs. Testimonies of the Foundation's unquantifiable investments in the well-being of ordinary people abound across Nigeria. The first 10 years of the Foundation has been a remarkable journey of touching lives.
It's inspiring to have a private individual who is not forced by anybody, who chooses to use some of his hard-earned money to invest in the lives of millions of people that he doesn't know. And like he will put it, that's a way of giving back, a way of showing appreciation to God, to impact humanity.
He has actually transformed lives and helped to create a lot of impact, particularly in communities where a lot of things are needed to improve the quality of life. But having a cause like the one he has that actually sets out to impact the lives of people, to change the dynamics of the Nigerian country, I think it's an awesome work that he's doing, and I sincerely commend the Foundation.
The impact, the stories, the excitement, the ecstasy, the gratitude will tell you that it's been a worthwhile experience.
$122 million Nigerians are at risk of one or more of 13 neglected tropical diseases out of the 17 recognized by the World Health Organization. Much of the foundation's work has been geared towards breaking the cycle of poverty caused by the adverse impact NTDs have on the health and economic development of Nigeria by working with partners such as Mission to Save the Helpless to control the spread of neglected tropical diseases.
1 billion people are infected by NTD. 40% is in sub-Saharan Africa. 25% of that, they are in Nigeria.
About 129 million Nigerians require at least one treatment of the 4 common neglected tropical diseases. Up to 50% of them are children.
This is exactly why the T.Y. Danjuma Foundation has invested significantly in the first decade to stem neglected tropical diseases in Nigeria. More than 1.1 million Nigerian adults are blind, and an additional 3 million have visual impairments. Overall, 42 out of every 1,000 adults aged 40 and above are blind. An estimated 88% of the blindness and visual impairments in Nigeria are due to avoidable causes, most commonly cataracts. The foundation has poured funding into comprehensive eye care services in underserved communities and public schools so that hundreds of thousands of Nigerians can receive free life-changing services. The Executive Director of Care Vision Support Initiative gives an insight into the Foundation's work on preventable blindness.
We have seen over 50,000 people with different eye conditions, and we've operated over 15,000 cataract cases. This intervention have significantly reduced preventable blindness. There was a family, from the mother down to the children, had cataract, and we operated on them and were able to bring them back their sight and their vision.
Ciwon idon na tun da na tashi a karamin yarinya, yara na suna da ciwon idon nan. A da mai gida ya je ya kawo mana abinci, baba zai yi holo don ba abin da an nuna masu ba su yi abin ba su gani ba. Ba na yi tashi ne kaɗai, in na zo ma ba zan san hanyar gidana. Mai gidana ne ya je ya ji labari daga Ukari. Ta ce Tiwa yana taimakon mutane. Mun gi hanya tukuna mun samu wannan zarafi. Rayuwarmu yanzu muna yi komi da wanke-wanke, muna wanke, muna je gona, muna aiki. Mun ji daɗi.
There is an acute shortage of access to quality, affordable healthcare throughout Nigeria. Fewer than 5% of Nigerians have health insurance, while 95% pay for healthcare directly out of pocket. This catastrophic approach to healthcare pushes millions of Nigerians into poverty. The T.Y. Danjuma Foundation has invested significantly since 2009 in providing free medical and surgical services at the grassroots to help arrest the cycle of poverty and increase access to quality and affordable healthcare to underserved communities.
ProHealth International and the T.Y. Danjuma Foundation has touched lives in Taraba State, Edo State, Nasarawa State, and the Federal Capital Territory. In these locations, hundreds of thousands of lives have been affected. We have provided free medication. We've carried out health education and HIV/AIDS education. We've done surgery, general surgery, gynecological surgery, dental surgery, and eye surgery to thousands of patients. So we work with state governments, we work with local governments to strengthen the healthcare system. So that's been amazing.
The board, we got a proposal from a group of well-trained surgeons in clefts and the facial deformity surgery, and we started funding them to visit as many states as possible.
The facial deformity has a tremendous effect on the psychology of people.
They are stigmatized, they are traumatized, and often cannot afford the surgery.
You now take such a patient to theater, And in a matter of 1-2 hours, the patient is back completely transformed. The reaction has always been instantaneous.
Beneficiaries of the Foundation's free medical and surgical outreaches, such as Florence Edemati, are amongst the most grateful, who are happy to share their story with the world.
I sleep, I wake, meet my face deformed. So from there, many people, they see me the wrong when I get that problem. People, they fear me. Even my own family is safe. My confidence is low, from the beginning, but me, I don't want to make my face make it put me down. I won't stand back on my feet. I'm not going to depend on people. Where they walk out for road now, they see somebody. And it just directs me to Danjuma people when help me remove that growth from my face. Not collect money from my hand, though. Even transform me. And people, when they see me, they run before. Now even them, they near me. I won't tell people as they may get similar problem the way I be. I believe in weakness, so see me. And so for them to get hope, say, if them fit do my own like that, hope fit there for them too.
1 in 8 Nigerian children die before the age of 5 from preventable diseases. A high maternal death rate means 1 in 34 Nigerian women will die from childbirth-related causes. The T.Y. Danjuma Foundation is committed to increasing access to maternal and child health services, particularly in poor and rural communities. The foundation has supported the renovation of hospitals across the country and trained thousands of health professionals. As part of the foundation's commitment to promoting the health of women and children, the foundation constructed a state-of-the-art maternity in Takum, Taraba State. That has become a source of hope for many in and out of the state seeking access to quality maternal and child health services.
It's been statistically shown that when you've improved facilities, maternal care and training, it makes a huge difference in reducing infant mortality and improving maternal health.
With regard to Danjuma maternity in Takum, we have saved a lot of lives since we started. We've not registered any maternal death in this facility.
The foundation wants it to be the best maternity center, not only in Taraba State, not only in Nigeria, but international standard medical facility.
We have specialized hands there. Light is 24 hours, water is 24 hours.
When I saw the facilities, first of all, I was like, wow. I don't think there's any other place you can get a facility like this, even in the cities.
Development Africa partnering with the maternity center is not just reaching out to this community. The facilities and the medical personnel that we have available is actually making an impact on the entire region.
Traditional birth attendants are a critical component of Nigeria's health system, as millions of women in rural communities across the country depend on them for childbirth. This is exactly why the T.Y. Danjuma Foundation has been working with local partners in different parts of the country, especially in Akwa Ibom, Imo, Niger, and Cross River State, to build the skills of traditional birth attendants. The head of St. Monica's Health Center in Yakoko, Taraba State, sheds some light on the importance of training traditional birth attendants.
We train traditional birth attendants to go into the interior to help delivery, to make sure that the baby and the mother are safe. And for any complication, they refer them to the center.
In building the capacity of traditional birth attendants, the foundation lays emphasis on making referrals to a higher and appropriate level of care at the right time, as testified by Hadiza Audu Sule, a traditional birth attendant in Donga, trained by the foundation.
Ina da yara 4 jikoki 5. Na gode wa Allah. Ne hanna kaya yin karshen aihuwa na ban samu matsala game da aihuwa ba. Da wata ba ma zuwa asibiti muna kama wa junan mu aihuwa. Akwai wata tsohuwar da take tare da mu tana koya mana ya kama aihuwa. Nace a'a ni kama angon zoman nan gomin matsala asibiti. akwai su wanda ciwo ya turo aka zo aka yi mana sun ce da mu duk lokacin da muka tsinci kanmu macen ta ka mana aihuwa a gida in ba wanda ya zo shafshaf ba da mu tabbatar mun dauke ta maza mun kai ta asibiti saboda a ja gwada ta da jinjiri da ita kanta a san lafiyan jikinsu. Akwai su wanda aka yi mana game da yanzu akwai bambanci ya ba mu karfin jiki saboda ciwo-ciwon da suke duniya yanzu mun gane da ba mu gane ba yanzu mun gane. Ina farin ciki ga gamu da rayuwar angon zoman da nake.
According to the National Agency for the Control of AIDS, NACA, Akwa Ibom State has the highest HIV prevalence in the country at 5.6%. HIV prevalence among pregnant women aged 15 to 24 years is also highest in Akwa Ibom State, where a large percentage of women rely on traditional birth attendants and do not go to health facilities for antenatal care services due to poverty and lack of trust in the healthcare system. To reverse this trend, the Foundation and its partner, Rural Resource Development Center, are working to improve the uptake of antenatal care and HIV prevention services in Akwa Ibom State by building the skills of health workers, linking mentor mothers with pregnant women, and training traditional birth attendants on timely referral of pregnant women to health facilities for expert care and delivery. As explained by Winifred Andre Essien, a beneficiary of the project in Akwa Ibom State, the intervention has been truly life-saving and motivating for most of the women.
Danjuma Foundation. Because I thought you could see some bomb. Imisi sang, Ibon Tibok, Item. Ibok, came from Ibon Tieno, Kety, Danjuma, Eseki, in on Bukeru Kerini, Naji, Ibo, Tienon 3. Is a sorry, Mamino Kerukerini. When something one Nika in Tete, got my about 3 non favorite and teatronic, Nenka go from Moya, Yakuta, even on modern Major, it's a casual for a day, no, it's a casual funny barrier, when Bunty, Imanagan, Kif, came so, yet in time, work accurate, and feel okay, my will film one night, and Kulum by so film. So that non Kulum by some common more, Sasa. Get him was in, I mean, on you, it's in the kingdom, get can tell come more, I was young, see you wise. Danjuma.
An estimated 10.5 million Nigerian children aged 5 to 14 do not attend school. More than 50% of girls, especially in the northern part of the country, do not complete primary education. A shortage of schools and qualified teachers and the burden of school fees on poor families are all major barriers to education throughout the country. In order to promote access to quality education from Nigerians, the T.Y. Danjuma Foundation has invested in programs that build and equip classrooms, as well as encourage enrollment, retention, and completion of basic education. It has funded teachers' training and retraining to enhance the quality of education given to children, and has also supported efforts to improve adult literacy. Whether it is in Dako community of the Federal Capital Territory or Fulantaran in Bauchi State, in which the foundation constructed the first schools, the story is the same: an acute shortage of infrastructure.
There was no school, no hospital, no government presence in the community. So we discussed with the community, started a series of advocacy, sensitizing the community on the need for education, and started the first and only primary school in the community.
Pupils were studying under the shade of a tree, but we constructed one block of 2 classrooms.
The The foundation recognizes that bricks and mortar alone cannot improve the quality of learning outcomes. This is why, in addition to constructing classrooms and sanitary facilities, the foundation is also investing significantly in building the capacity of teachers to better deliver lessons, as attested by Hassan Yakubu Umaru, a school teacher in Bauchi State.
Sunana Hassan Yakubu Umaru, na kai shekara 30 ina koyarwa. Kafin a ce an mana koyarwa, sai dai ka tabo can ba. Baka san mata ina za ka fara ba, baka san ta ina za ka ci gaba ba, baka san ta ina za ka tsaya ba. Gaskiya fahimta ta fahimtar da mu abubuwa da dama. Ta kai mu auto ta mana training akan record keeping, school management da kuma documentation. Sun dauke mun je mun koyo yadda koyarwa na zamani yake. Mu ba wani kuɗin da muka biya. Gaskiya muna ta shan wahala ne, da lokacin da Danjuma Foundation suka dau nauyin mana ginin nan, gaskiya mun ci gaba da yawa. Da lokacin yara ƙanana ne kaɗan ne ba su da yawa suke zaune a ƙarƙashin bishiya. To sai kasance lokacin da aka yi haka mun samu yaro ya kai sama da 100 wanda suke cikin azuzuwa suke karatu. An yi mana toilet da kuma gidan malaya, ba wata kalar makarantar da kai wannan. Babu irinta a wannan area.
Millions of children are out of school partly because they cannot afford one meal a day. This is why the T.Y. Danjuma Foundation is one of the first non-governmental organizations to focus on providing one balanced meal a day to pupils in Dako LEA Primary School in the Federal Capital Territory and Fadama Primary School in Takum. The result has been an increase in enrollment and performance by the pupils.
With the school feeding came a significant improvement in terms of enrollment. The population within the first term doubled.
As a result of this food, we have seen great change. Anytime if they see this woman coming with the food, they will start jubilating in the class. Our food is coming, our food is coming.
We have a Sponsor a Child program, and it's our hope that we would have more children go to school, graduate, and then come back as agents of change in their communities.
They say educate a girl and you educate a nation. The investment in girl-child education by the T.Y. Danjuma Foundation is a testament of the foundation's commitment to educating the nation. In communities across Nigeria, the foundation has provided libraries to deprived schools, paid the fees of underprivileged pupils, and created conducive learning environments. This is the feedback from its partners.
They have provided sanitary pads, school bags, school shoes, a lot of things. So we build up confidence in these children. They gave us a very standard library with some books there. So some of the students who cannot afford textbooks can easily go there, borrow, and then return.
In Anambra State, just like in other parts of Nigeria, where the T.Y. Danjuma Foundation has invested in building and equipping libraries, beneficiaries are re-echoing the invaluable contribution of the foundation in promoting access to quality education in Nigeria.
Foundation no amatara mfa mgbe nọ na America mba ofesi njekuzi obodo iwe fụ ka ndị nne na nna si akpọta ụmụaka ha na nya bụ ọdọ akwụkwọ ofu onye wee kọwara m no library bụ the real democratic dividend enwere n'ụwa niile maka na iburu ogbenye ihe abịa na akwụ ụgwọ iburu ọgaranya ihe abịa na akwụ ụgwọ foundation nwa anyị na ndị mụnwa hiberie mana enweghị m ike imenwe ihe dị na ya na ọ bụrụ na eweziga enyemaka T.Y. Danjuma Foundation ọ ha gbatara anyị ọsọ enyemaka site n'inye anyị ihe a na-akpọ discretionary grant nye ka anyị ji wee nwee ike bido nya bụ library ọdọ akwụkwọ ihe anyị ji hiwe foundation nwa bụ ma ọkachasị ọdọ akwụkwọ nwa akpọ library ka ụmụaka anyị nwee ike inweta ntọala ga-enyere fa aka ịba na nkeji dị iche iche n'ihe ọmụmụ nke ndụ bido na kindergarten, primary school, secondary school and university ka ha nwee ntọala ha nwee ike iji gbago nwee ihe ọkammụta ka ibefa n'ime ụwa anụnwa ya na onye ọbụla chọrọ ịbara onwe uru ntọala anyị dị na library onye chọkwara ịghọ achọghị ka ọ baa uru nye abịa na library mana onye ọbụla ya bụ uru ya eje na library mara ebe a ka o ya eficha akara aka odo ya anya otu o esi bara onwe uru bara ezinụlọ uru bara obodo uru bara nzukọ uru bara ụwa niile uru. So anyị na-ekene TY Danjuma onye nyere anyị aka site n'inye anyị ego anyị wee bido nya bụ library.
The investment in girl-child education has been transformative for some of the foundation's beneficiaries. Mercy Brimo, the head girl of St. Angela's Grammar School in Jetu, Edo State, is only one of such beneficiaries with an inspiring story.
When my dad died, we were 6 in number, so my mom could not afford my school fees. Then me, I was doing all those home jobs. I was helping people to wash clothes, wash plates, wash dishes, bath the children, hug, to afford for my school fees. I worked hard. It's when I came to St. Angela Girls Grammar School. That's when I found this club, Girl Child. They enroll my WAEC and NECO and my lesson fee for me. I want girls to go to school because some girls don't have the knowledge to stand on their ground. If an educated woman go to school, like she has her own job, her own house, her own cars, she's doing her own things, no man will rubbish her.
The United Nations Development Programme estimates the literacy rate in Nigeria at 61%, while Nigeria's National Commission for Mass Literacy, Adult and Non-Formal Education estimates that 35% of the country's adult population is illiterate. The TY Danjuma Foundation has worked across the country to reverse this negative narrative by investing in adult literacy.
When I came to this school, it was as if I was in the dark. They just started us from alphabet, and that made it possible for me to read and write.
The teachers, they were coming house to house. That is why when they came, I now follow them. I feel so good because from here, I may go to College of Education.
I also have children at home. There are some subjects that I even teach them. They're in the secondary school, but I teach them. And they're surprised that their father has reached that level.
Education is one key sector where if we don't get it right in Nigeria, we'll never get anywhere. So I commend the work of the TY Danjuma Foundation, particularly in the area of education, in the area of helping the less privileged. I also commend him personally.
In line with the vision of the foundation to contribute in building a Nigeria where all citizens have access to quality healthcare, education, and opportunities to realize their full potential, the foundation has supported income generation initiatives that have transformed lives at the grassroots.
I've been here since 1985. We have cassava. Before this may come up, inside your 4 acre, we will only process 2. And because of that, we are not getting money. We went to our Farmers Association meeting. They told us about TY Danjuma Foundation. Many of us applied. We don't know anybody there. We only just say, God just do the work for us. Because of this factory now, many have established. The community, they are so happy to the extent that the cassava farm they are doing is not wasting again. Like all those students, so when they are on holiday, they come here. We give them a job. They do. We help them. If he keep this money on his own, we will still stay on where we are today. There will be no improvement for us.
The foundation's investment in income generation has been transformative in the lives of community women, as explained by Elder Ogundare, who received funding from the foundation to set up cassava processing factories for women in Ekiti and Ondo State.
Mo bá ìrìn àjò pàdé pẹ̀lú àwọn obìnrin tí ń ṣe gàrí nígbà tí mo ń ṣe àwọn iṣẹ́ kan ní ìgbèríko. so ní ìgbèríko yẹn mo bá àwọn obìnrin níbi tí wọ́n ti ń yan gàrí, wọ́n ti ń bẹ̀rẹ̀ láti bẹ́, láti fọ́, láti lọ̀, láti yán, and ìdẹ̀rí akitiyan bó ṣe pọ̀ tó. Wọ́n nǹkan kan tí mo rí bí àléébù gbà yẹn ni pé tí àwọn obìnrin tán bá lè gbé wọn lárugẹ tán ṣe iṣẹ́ yìí, lẹ́yìn ìgbà tí ìgboro bá ti kún fún gàrí tí a jẹ tá a yó pé a lè mú jáde lọ sí ìlú ibòmíràn. And fortunately grant tí Why Danjuma wá fọ̀ sí time yẹn, and pẹ̀lú èròǹgbà ọkàn mi yìí tá a lè pè ní idea, mo sọ sínú paper pẹ̀lú oore ọ̀fẹ́ Ọlọ́run a fún mi ní grant. Ìgbà tí mo lo grant tán fún mi tán 2 million lápá bí tí mo máa lò tán, ó jọ wọ́n lójú pé nǹkan tí Ọlọ́run gba ọwọ́ wa láti ṣe. So a ti kọ́ ilé, a ti ní ilẹ̀ fún, ṣùgbọ́n ó wá kó àwọn kan tá a máa lò. So ìyẹn wá tún mú question mìíràn jáde pé ṣé ibi tá a dé ìṣó ti tẹ́ mi lọ́rùn? Iṣẹ́ pé ó tẹ́ mi lọ́rùn, ṣùgbọ́n aṣáàtìrí ibì kan táwọn obìnrin lè péjọ sí táwọn ti lè máa ṣe oúnjẹ wọn. Èmi rí i pé nǹkan tó mọ̀ ọ́n ṣe wọ́n fi tọkàntọkàn taratara wọ́n fi ń ṣe, ìyẹn gan ló wú mi lórí. Lérèfé a wá kọ ìwé mìíràn tá a fi máa ra àwọn machine, àwọn oríṣiríṣi nǹkan tí a gbé iléeṣẹ́ yẹn lárugẹ. Inú mi dẹ̀ dùn nígbà tí bàbá wa tán approve ẹ̀ fún mi, and títí di àkókò yìí nígbà tá a máa fi parí ẹ̀ tán iléeṣẹ́ ti dúró, àwọn obìnrin ti rí àyè láti ṣe iṣẹ́ tán mọ̀ ọ́n ṣe. So lọ́jọ́ ìní mo ní ayọ̀ láti lè sọ pé gàrí táwọn obìnrin wa ṣe ó ti bọ́ sí ohun tí à ń béèrè fún kódà ní ìlú òyìnbó. Ìgbà tá a agric processing, World Day Food Day tó máa ṣẹlẹ̀, tá a gbé gàrí wa síta, Governor of Ondo State ó honor wa, and then àwa la ṣe ipò kejì lọ́jọ́ yẹn, wọ́n dẹ̀ fún wa ní gift, and it's more or less pé mo fẹ́ kí gbogbo èèyàn mọ̀ pé ọ̀dọ̀ bàbá yìí ni orísun mi ti jáde wá. Kódà nínú gàrí wa rí logo tí Why Danjuma mo sì fi síbẹ̀. Bàbá wa try, ẹ̀tì ibi tó try dé fún mi, ibẹ̀ náà ni mo ti ń bá yí láti gbà yín. So Ọlọ́run dẹ̀ ń gbà fún wa, wọ́n recognize wa ní Ondo State.
The foundation has supported an array of skills training and income-generating initiatives, especially for youth, women, and people living with disabilities. One of such persons living with disabilities who has been empowered by the foundation and its partner, All Children Charity International Foundation, is Gideon Elia, who has gone ahead to establish a business for himself and employ a number of youths in Bamawa, Kaduna State.
Lokacin na karami ban kai shekara 4 ba, sai na samu matsala da kafa. Har na fara ja a kasa, na tafiya a kasa for good 7 years. Mutane sai su wuce su yi dariya su ce wannan ba zai iya wani abu ba, wannan rayuwar shi kenan, rayuwa na ya kare. Aka samu calipers 1.5 years sai na fara tafiya da kaina, aka cire mu calipers din, sai na fara zuwa makaranta. Na gama 2007 na koyi dinki for good 2 years. Shine asif suka doke ni suka yi min training 2012. Ba mu biya ba, free ne muka yi, kuma a wurin ma muna zuwa training din suna ba mu abinci a rana sau daya. Suka bude mana shaguna guda 4 wanda suke na yanzu kananan yara ne, su ma sun zo sai register da cewa za su koyi aiki da ni. Da sai mu wannan training har na fara wannan shoemaking. Bana tambaya babana kudi ko kuma mamana, wani lokaci in akwai bukata in ina da shi ni ma nakan ba su.
The foundation has continually responded to the needs of persons across Nigeria affected by disasters such as flooding, diseases outbreaks, and displacement due to crisis. Beginning in 2011, the foundation has been responding to the humanitarian crisis ravaging the northeastern part of the country by investing significantly in programs aimed at alleviating the suffering of persons displaced by the crisis.
The destruction in the northeast left behind 3.2 million households without food, water, and shelter. We provide food commodities for them and keep them alive before we transition them to livelihood and then provide the skill sets. Irrespective of the location where they are, the idea is to ensure that they are able to make a living from these interventions that we've given.
Tenny and Raul, whose family was hurt and displaced by the insurgency in Borno State, narrates how the foundation's support to IDPs like her has brought the much-needed relief to her family.
Boko Haram suka zo wurin mu. Fin da na ji da na gan garin mu gaba daya an kone shi. Ba kome na fara guduwa. Lokaci ma ina da ciki. Ga yara a hannuna sai aka zo aka kashe babana. Muna kan guduwa muka ganga abinan kanin mama na aka kashe da kanina. Kwanan mu 4 muna kan hanya. Yara ma suna kuka ba abinci. Da muka zo Maiduguri muka ji cewa TY Danjuma yana rabar da kati. Sai Allah ya taimake ni na samu abincin. Da muka karba abincin shine nake doka wake da mai a ciki. Na fara tuyan kose. Ya taimaka ni sosai. Yanzu dan na fita kose zan yi diba ma yara na kose wannan aleda mu karya da shi. Amma kungiyar da nake ji da cewa ya taimake ni TY Danjuma ne.
The impact of the first 10 years of the TY Danjuma Foundation can be seen in transformed people and communities throughout Nigeria. It is the foundation's hope that the results of its trailblazing approach to targeted, private philanthropic giving will serve as a motivation for other Nigerians of good fortune and all people of goodwill to join the TY Danjuma Foundation in lifting fellow Nigerians to live more meaningful and fulfilling lives.
TY Danjuma Foundation look out for young, small NGOs to build up. It's about the capacity, it's about integrity. What impact is this particular intervention providing?
I started like a surgeon that wanted to help. I did not have a registered organization, but they started teaching me how to get things done from NGO perspective.
It's a thing of pride. The fact that it's a Nigerian-grown grant-making organization that is particular about building institutions that will endure.
They have a focus and they know why they should go out and help these people because they live with them and they see them.
You know, when you have a giving heart, there's nothing that can stop you. You just continue regardless.
There's probably nothing that has given me so much joy in my life.
To bring smile to somebody's face, doesn't matter how much, doesn't matter what is involved.
It pays to touch lives. It becomes a kind of chain reaction. You empower a man, he empowers another person, it goes on like that.
We're not created to be a problem. I believe that each and every one of us is a solution to the next person.
When we tell our story, we say that TY Danjuma Foundation is the only Nigerian private foundation that is funding us. And we hope that this relationship will continue forever. So it's a privilege. I pray that we can do more. I hope we can do more because the needs are so much.
I want to thank TY Danjuma Foundation most heartily. I commend him personally for being detribalized and being humble and very, very accessible to the ordinary Nigerian. I believe that kind of gesture not only inspires others, but it also goes a long way towards enhancing national unity, national development, national cohesion. So we need more people like him.
Professionals must all wake up and try and see whatever they can do in their strong area of expertise.
For other Nigerians who would like to begin philanthropic work to learn from the TY Danjuma Foundation.
Well, he's not the only man that has money in Nigeria, but the passion he has is unprecedented.
He sees it as his duty, and that has been passed along to the staff of the foundation, to the trustees. It's our duty to make sure that we do as much as we can to help our nation. It just takes a little to change a life.
Too often, we forget that to go far as a nation, we must go together, working towards a common cause. By forging durable partnerships with local governments and communities, the T.Y. Danjuma Foundation is supporting transformational interventions in restoring sites, educating the youth, eradicating neglected tropical diseases, providing clean water, saving the lives of mothers and children. It is through such partnerships and collaborations that the nation shall be transformed into the Nigeria that we envision.
In the first 10 years, through dedicated partnerships with strong indigenous organizations, we have made a difference in the lives of millions of Nigerians. We have only just begun to address the needs we see, and we want to inspire you to join us as we discover new ways to improve our nation and help our communities wherever we are, however we can.